Nephrectomy, nephro equals kidney, ectomy equals removal, is the surgical removal of a kidney. The procedure is done to treat kidney cancer as well as other kidney diseases and injuries. Nephrectomy is also done to remove a healthy kidney from a donor, either living or deceased, for transplantation. A nephrostomy is an opening between the kidney and the skin. A nephrostomy tube is a thin plastic tube that is passed from the back, through the skin and then through the kidney, to the point where the urine collects. Its job is to temporarily drain the urine that is blocked. Nephrotomy is a surgical procedure wherein the kidney is incised. It is usually performed as part of a more extensive open surgery procedure, such as radial nephrolithotomy and anatrophic nephrolithotomy, among others, typically for the removal of urinary tract stones. Nephrolithotomy is a procedure used to remove kidney stones from the body when they can't pass on their own. Nephrectomy Partial. The physician removes a portion of the kidney. To access the kidney and ureter, the physician usually makes an incision in the skin of the flank, cuts the muscles, fat, and fascia overlying the kidney, and sometimes removes a portion of the 11th or 12th rib. After mobilizing the kidney and the major renal blood vessels, renal pedicle, the physician clamps the renal vessels. The physician excises a wedge containing the diseased or damaged kidney tissue. After clamping and ligating the exposed arteries and veins, the physician inserts a drain tube, bringing it out through a separate stab incision in the skin, removes the clamps, and performs a layered closure. Nephrectomy, including partial ureterectomy, any open approach including rib resection. The physician removes the kidney and upper ureter, but does not remove the adrenal gland, surrounding fatty tissue, or Gerotis fascia. After controlling bleeding, the physician irrigates the site with normal saline and places a drain tube, bringing it out through a separate stab incision in the skin. The physician removes the clamps and performs a layered closure. Nephrectomy, including partial ureterectomy, any open approach including rib resection, complicated because of previous surgery on same kidney. Radical, with regional lymphadenectomy and / or vena caval thrombectomy. The physician removes the kidney, upper ureter, neural and vascular structures at the apex of the renal pelvis, surrounding fat, Gerotis fascia, adrenal gland, and involved renal lymph nodes. The physician irrigates the site, places a drain tube, removes the clamps, and performs a layered closure. In a transthoracic approach, the lung is re-expanded and the chest tube left in. Nephrectomy with total ureterectomy and bladder cuff, through same incision. Through separate incision. The physician removes the kidney, ureter, and small cuff of the bladder through one excision. After mobilizing the kidney, ureter, and bladder, the physician clamps, ligates, and severs the ureter, major renal blood vessels, renal pedicle, and a small cuff of the bladder. The physician pulls the kidney, ureter, and bladder cuff upward through the flank incision. The physician does not remove the adrenal gland, surrounding fatty tissue, or Gerotis fascia. After controlling bleeding, the physician irrigates the site with normal saline and places a drain tube, bringing it out through a separate stab incision in the skin. The physician sutures and catheterizes the bladder, removes the clamps, and performs a layered closure.